Hi everyone, this is Amy Reich. Thanks for joining me for this Health at Every Size, or HAES, overview. This is a very exciting and interesting evidence-based presentation, and it might be giving you something that you've never seen before, never thought about before. It's really important here to keep an open mind as we talk about that sensitive topic of weight and health. This approach to health and wellness that we'll be talking about in this overview might be quite different from things that you've heard of in the media or in previous courses, and so on and so forth. And I would love to just acknowledge the three organizations that have sponsored this curriculum and presentation. They are the Society for Nutrition, Education, and Behavior, the Association for Size, Diversity, and Health, that's ASDAH, and the National Association to Advance Fat Acceptance, NAAFA. You can find out more about those organizations by going to the web. All right, so again, I invite you to look with and take this in with an open mind. We'll start looking at the basics and we'll go from there. Thanks for joining. The public is so confused when it comes to weight and health. When individuals focus on losing weight, it can definitely result in an interesting head game, which is represented here by this cartoon. If I gain 20 pounds, it will give me the motivation I need to stick to my diet. And you may have seen and heard some humorous takes on this yourself, maybe even in your own family. All right, so think about that for a moment. Let's talk about the definition of health at every size, which is also called HAES, as you can see here. So with health at every size, it's all about taking the focus off of weight, and in doing so, we end the head gain that's so common with dieting. This is a non-diet paradigm, which some of you may have heard of before, the non-diet paradigm or approach. And really with this, we're focusing on health instead of weight. So I'm going to say that again. The focus is on health, not weight. Throughout this presentation, I will refer to health at every size by using the acronym HAES, as I already said. HAES and health at every size are trademark terms, and they were trademarked by the Association for Size, Diversity, and Health, which is an organization that promotes taking a non-diet approach to wellness simply because, are you ready for this? Dieting doesn't work. The HAES paradigm is about paying attention to hunger and fullness cues to guide eating instead of counting calories or fat grams, finding pleasure in food and satisfying cravings, and trusting that your body will naturally crave a variety of foods. And variety is key. The HAES paradigm is also about movement, being active not to lose weight, but because it feels good and has many positive health benefits. And taking the focus off of weight, the HAES paradigm involves promoting a positive body image. And that's been quite common lately, the body positivity, the positive body movement. So again, promoting a positive body image and seeing weight and body shapes and sizes as just another component of diversity, just like our body height, our skin color, our hair color, the texture of the hair, and so on and so forth. So in this presentation, we'll be exploring this HAES paradigm and exploring the research that supports it. And it supports that this approach might just be the best for promoting wellness. And there's that word again, wellness, health and wellness. However, before we do this, we're going to start with the basics. First, we'll define terms such as health and terms such as overweight and obesity. Next, we'll look at changes in body weight in the United States over the last several decades. We'll also take a look at the research today to explore the relationship between weight and health. We'll talk about various dieting or weight loss interventions that are out there, and you know there are so many of those. And we'll look at the effects of those interventions on health. What we'll discover as we look at the data is that, and are you ready for this again? Diets don't work. Health at every size seems to be a promising alternative, I should say, to dieting. Today, we'll look at the research that supports this approach to wellness, this non-diet approach. We'll also talk about one of my favorite terms, the weight neutral term as a term that describes taking the focus off of weight. And here we go again, on to health. We'll finish by debunking some common misconceptions of the health at every size approach. There are definitely a lot of those out there. This message is so countercultural. Well, depending on who you're talking to, but definitely it's pretty countercultural and confusing. Definitely. So today we'll just be able to just scratch at the surface of the evidence in support of health at every size. Today's presentation is simply an overview of the HAES paradigm. You'll probably be left with many questions, and hopefully we can answer those, or I can help answer those for you through some other work that we can do together. I will be offering some other programs where there's more interaction. Thanks, everyone. When we look at messages about health in the media, the focus is always on weight, isn't it? So let's define weight and health. The message is always, if you're thin, then you're healthy. If you're fat, then you're not. Isn't that true? That's the common message. Think about that. We also see a lot of information about nutrition and exercise. The message is eat better and you'll be healthier, exercise more and you'll live forever. Do this cleanse, try this diet, do this exercise, and so on and so forth. And really the truth is there's a lot more to health than weight and even nutrition and exercise. And that might sound a little odd too and new. Keep an open mind for that as well. There are so many components of health that do not include diet and exercise. Have a look here at this wheel of life, and you can see all these different areas and components that make up our life that do have an impact on our health. Our diet, exercise, emotional state, our social life, spiritual, intellectual, environmental, occupational, and even more. Well, an example could be in your life. Maybe you're following a paleo diet, you're exercising, and you're eating overall nutrient-dense foods. However, you might be feeling really stressed out and deprived. You're trying to follow this diet. So does that make it healthy? In fact, following many different diet plans and regimens, we can feel restricted and stressed out just trying to follow it. That does not make one healthy, does it? Given that emotions are an aspect of health, emotional health can definitely be compromised when we're putting too much focus on these other areas of health. It also could make us stressed out and say if you're invited to go to someone's house for a meal, and maybe that's a big part of your life is going out to eat or social eating or meetings and having food. That can bring a lot of stress too, just trying to figure out what to bring. So maintaining health will involve balancing all of these different aspects in this sort of circle or wheel of life here, balancing them out and making them work for you in a personalized and individualized manner. There's so many limits of lifestyle change on health. For example, an individual could have the perfect diet and exercise patterns, but they could still get diagnosed with a cancer. It's true. So while diet and exercise and all the other circles on here are very important, your individual's health also has to do with factors such as genetics, access to health care, and social equality, just to name a few. So we've defined health. Now let's look at how weight is defined. What exactly does it mean to be overweight or obese? Like overweight, over what? That's how I like to say it. Overweight over what? Overweight and obesity are categories used to label weight relative to height. You might be familiar with the BMI or your body mass index, this chart here. So this is used to categorize individuals into one of four primary categories. We've got underweight, normal weight, overweight, or obesity. So what are some limitations to using BMI to access health? Well, the super common answers are it doesn't take into account your muscle versus your fat mass. And I've seen many examples of that. It doesn't take into account your fitness levels. It doesn't take into account differences in muscle mass between genders. All something to consider here. Let's keep in mind, BMI was meant to be a screening tool, not a diagnostic tool. It's a screening tool. Very basic and not one size fits all. Actually, it is one size fits all, excuse me, but that doesn't really work. So one of the questions that we're going to talk about as we go along is whether the BMI is an adequate indicator of health. In other words, can you just tell by looking at someone's height and weight if they're healthy? Think about that. Can you tell by looking at someone's height and their weight if they're healthy or not? So moving on, we're going to look at changes in weight over time. We've discussed definitions of health and weight, and we'll see how the weight and health have changed over the last several decades. The changes in weight over time. According to the CDC, Center for Disease Control and Prevention, we are in the midst of an obesity epidemic. While there have been some increases in weight over the last 40 years, it appears that this rise has begun leveling off in the last decade. Furthermore, some of the increases in weight can be explained by adjustments that were made to the categories of the BMI along the way. This one really gets to me specifically in 1998, and I don't know if any of you listeners out there know this, but in 1998, the BMI that labels someone as overweight was lowered, impacting the percentage of individuals categorized as overweight. So think about that. You could have gone to bed one night being what's so-called underweight according to this BMI scale, and the next day you wake up and now you're overweight. And some overweight people might have jumped from overweight to obese. And people are following this. Just something to think about. This graph provides evidence that based on BMI, there's been a leveling off in recent years. There's been a slight increase in what is labeled the morbid obesity category in males, but relatively stable in other categories for both males and females. Despite this leveling off, the CDC still says that overweight and obesity is on the rise. Changes in weight have leveled off in more recent years, and yet many are still using the term obesity epidemic, suggesting that fatness is detrimental to health. So next, we will definitely take a closer look at this assumption. Join me. Oh my goodness, we have declared war on obesity. Look at this. I want you to lose some weight. Despite the leveling off of weight in recent years, serious language, as you can see here, has been used to seriously scare the public into trying to lose weight. Terms such as declared war and obesity plague or obesity epidemic have been used. Statisticians and economists have attempted to put a price tag on this epidemic based on statistical associations between weight and health. We've all heard that obesity is associated with many diseases, including heart disease, stroke, type 2 diabetes, and certain types of cancers. Now, in order to understand the real story behind the obesity epidemic, you have to first understand the difference between association or correlation and causation. And I'll state those again. The difference between association or correlation or causation. These are some of my favorite terms to explore. A correlation simply means that there is a connection between two or more things. And I'll say that again. There's a connection between two or more things. For example, male pattern baldness is correlated to heart disease. So does that mean that male pattern baldness causes heart disease? No. Correlation just implies that there is simply a connection. If well-controlled trials are used to answer a research question, then we can determine if one thing causes another. To determine causation, there's that term again, causation, subjects in a study must be randomly assigned to either an intervention group or a control group and followed over time. Only then can we determine if the intervention caused the result. Without these types of well-controlled randomized trials, we can only make assumptions without causation. And this is where it gets tricky when we're reading research and articles in the media. Just paying attention to those words, correlation, causation. The problem with making associations between weight and health is that there are often other factors that could contribute to the disease, with weight being only one factor. Take fitness, for example. The few studies that have controlled for fitness have found that fitness is more predictive, of mortality than weight. Of course, an individual's overall nutrition plays a role as well. Researchers who control for socioeconomic status have also found that low socioeconomic status is linked to mortality. Research also suggests that a negative body image and perceived discrimination for size or other factors poses a threat to health. Researchers have also found that many negative health outcomes linked to that yo-yo dieting or weight cycling. As you can see, research regarding weight and disease is really messy. If these other factors aren't controlled for when looking at associations between disease and